You are welcome to my channel. I'll be talking about azithromycin. Azithromycin could come under different brand names: Zithromax, Zithromax Z-Pack, Zmax, ACT azithromycin, AG azithromycin, APO azithromycin, oral azithromycin, and so on. Azithromycin belongs to the class of medications known as macrolide antibiotics. There is an investigational process that is ongoing. They are trying to consider the combination of azithromycin with hydroxychloroquine in the treatment of COVID-19. We can all remember, everything about COVID-19 is still evolving, right? Azithromycin could appear in various forms, like solution to be reconstituted for intravenous use. Under that situation, you can find Zithromax 500 mg or generic 500 mg. Also, in form of suspension to be reconstituted for per oral use. And that could be under Zithromax 100 mg per 5 ml, Zithromax 200 mg per 5 ml, Zmax 2 gram or generic 100 mg per 5 ml or 200 mg per 5 ml. Also in another form as packet for oral use as Zithromax 1 gram or generic 1 gram. Also in form of tablet for oral use as Zithromax 250, 500 or 600 mg. Under tablet for oral, we can also have Zithromax Tri-Pack 500 mg, Zithromax Z-Pack 250 mg or generic 250, 500 or 600 mg. Administration. We cannot give Zithromax intramuscularly, no. And we will not give this as intravenous bolus medication like adenosine and so on, no. We can give it intravenous infusion at 2 mg per ml for 1 hour or infusion at 2 mg per ml for 3 hours. Immediate release tablet for oral usage or suspension can be given with or without food. In other words, without regard to meal, you can give immediate release tablet per oral or immediate release suspension. Still on administration of azithromycin, the extended release suspension should be given within 12 hours of reconstitution and at least 1 hour before or 2 hours after meal. Remember, I've just said it, that immediate release could be given without regard to meal or to food, but extended release must be given with regard to meal or food, 1 hour before meal or 2 hours after. No antacids containing aluminum or magnesium should be given with azithromycin, no. Please shake well before you use the oral suspension. Coverage. Azithromycin will cover gram-negative like E. coli, Salmonella, Shigella, Pseudomonas, Legionella, Gonorrhea, Movilus influenzae, and Bordetella pertussis. Also, it will cover Mycoplasma pneumoniae, Treponema pallidum, that is syphilis, Chlamydia trachomatis, or Mycobacterium avian complex, in other words, atypical bacteria. Also, it will cover gram-positive like Staphylococcus aureus, Staphylococcus epidermidis, Streptococcus pneumoniae, Listeria monocytogenes will be covered, Group A Streptococcus will be covered, Streptococcus agalactiae, and anthrax bacteria. Also under the coverage is Clostridium perfringens, Clostridium tetani, Clostridium botulinum, Bacillus thuringiensis, and Mycobacterium leprae. uses. Since we've gone over the coverage, you can easily take a guess where and when we can use azithromycin. In acute COPD exacerbation, in Chancroid, Otitis media, pneumonia, skin bacterial infections, strep pharyngitis, Acne vulgaris, Bronchiectasis, lung transplant with Bronchiolitis, Obliterans syndrome, Campylobacter jejuni, cat scratch, postoperative prophylaxis, Chlamydia trachomatis, Cholera, Cystic fibrosis, Endocarditis prophylaxis, Gonococcal infection, Granuloma inguinale, Lyme disease, Mycoplasma pneumonia, Pertussis, Gastroenteritis, Bacterial prophylaxis in abortion, syphilis, traveler's diarrhea, Mycoplasma dentalium, sexually transmitted infections that are bacterial in origin, PROM, not the one you are thinking of. Here it is premature rupture of membrane. Adverse reactions. When you give azithromycin per oral and you have given a very large single dose, you might run into diarrhea and vomiting. There is likelihood of increased fungal infection and oral candidiasis. Diaphoresis, skin rash, urticaria, decreased serum glucose, increased liver enzymes. Adverse reactions could also include abdominal pain, anemia, eosinophilia, cholestatic jaundice, hypersensitivity that could be as worse as Stevens-Johnson syndrome or toxic epidermal necrolysis, agitation, insomnia. Other reactions could be increased creatinine phosphokinase, arrhythmia, edema, prolonged QT that could degenerate to tozadipoin and ventricular tachycardia down to polymorphic ventricular tachycardia and to ventricular fibrillation if not corrected. If no defibrillation, then cardiac arrest and death. Pseudomembranous colitis, when you are named per oral for a long time. Contraindications. Don't give azithromycin if there is sensitivity to azithromycin, erythromycin, azilite, or catalyte. Don't give this medication in the face of hepatic failure or obvious with jaundice if the individual had developed hepatic failure or jaundice with prior azithromycin use. Then right now, don't give it. If there is concomitant pneumoniae use, please no azithromycin right now. Warning. We should remember that hypersensitivity to azithromycin is possible, and if that occurs, it could be so severe that it could lead to death. Also, we should remember that prolonged QT is very possible here, and if that is the case, it could degenerate to tozadipoin. Tozadipoin could degenerate to monomorphic ventricular tachycardia. That could go down to polymorphic ventricular tachycardia. If no correction, we can end up in ventricular fibrillation. If there's no defibrillation, then there might be asystole. And with that, if advanced cardiac support is not instituted with code blue being called immediately, the affected individual might end up in morgue. Like I've said, arrhythmia might be a side effect or complication. Then anyone on any antibiotic for a long time, and in this case azithromycin for a long time, can come down with super infection, particularly fungal. Increased mortality is possible in oncological patients, particularly if they have received hematopoietic stem cell transplantation and you are trying to prevent bronchiolitis obliterans syndrome. Azithromycin may mask gonorrhea or syphilis. So, in sexually transmitted infection, and you are suspecting gonorrhea or syphilis or both, it's going to be wise to have that test done to rule them out before you start using the azithromycin. If not, you might not get the true picture. Still on warnings, please be careful in the face of hepatic impairment. And the reason is that when I was going through the adverse reactions, I've stated that some people would have likely developed hepatic failure with jaundice. And even part of the contraindications is if that has been part of the history in this patient, don't give azithromycin to them. So be careful in the face of hepatic impairment because it can worsen the situation for them. In myasthenia gravis, we have to be cautious. And the reason is it can actually increase the exacerbation of myasthenia gravis. In renal failure with glomerular filtration rate that is pretty low, as low as 10 ml per minute, there's likelihood of increased gastrointestinal tract symptoms. So don't give azithromycin if you have now gone through the renal system and the glomerular filtration rate is less than 10 ml per minute. No azithromycin please. In infants, be careful, particularly infants less than 6 weeks. And why is that? They can actually develop infantile hypertrophic pyloric stenosis. So, why trying to help them? Will you add to their problem? Of course, no. Drug-drug interaction. I'm going to leave that to the pharmacist or the clinical pharmacologist in your jurisdiction. And the list, because the list is pretty long, I cannot go over all of them here right now. In pregnancy and breastfeeding, that's fine. You can give this medication in them. Monitoring, okay. Get your EKG ready, please. Remember, I've said now about 5 minutes ago that there is likelihood of prolonged QT going down to torsade point, and if no correction on time, torsade point can degenerate to ventricular tachycardia. If no correction, then can go down the hill to polymorphic ventricular tachycardia and ventricular fibrillation. If no defibrillation on time, then there can be asystole. With asystole, if no advanced cardiac life support, calling code blue within minutes, the patient might end up in the morgue, that is dead. So because you don't want to run into that trouble and you are scared of arrhythmia, get your EKG to monitor. And of course, monitor the electrolyte because low potassium, low magnesium would lead to prolonged QT. Mechanism of action. Azithromycin inhibits RNA-dependent protein synthesis. It binds to the 50S ribosomal subunit, resulting in the blockage of the transpeptidation. Examples of situations where and when we can use azithromycin are the following. In Lyme disease, you can use azithromycin 500 mg once daily for about 7 to 10 days. In Pertussis or pneumonia, you can give azithromycin 500 mg on day 1, then 250 mg once daily on day 2, 3, 4, and 5. Or if you don't want to go through this mathematical calculation on different days, you can just give 500 milligrams once daily for 3 days. Another example is in Acne vulgaris, where and when you can use azithromycin 500 milligrams once daily for 4 days in 1 month. Then you will repeat for the second and third month, or you go another route of 500 milligrams once daily for 3 days in the first week, then 500 milligrams every week for 10 weeks. In traveler's diarrhea, you can give azithromycin 1 gram start, or you can give it as 500 milligrams daily for 3 days. In hematopoietic stem cell transplant patients, when you are trying to handle bronchiolitis or Obliterans syndrome, you can give azithromycin per oral 250 milligrams daily for 5 days, then 250 milligrams daily 3 times weekly for 3 months. Or you can go another route of giving it 250 milligrams 3 times weekly indefinitely. And in cesarean section, you can give this medication intravenously as 500 milligrams start 1 hour before you place your knife, before the incision. And with that, I've come to the end of this very presentation. Remember to share, remember to subscribe to my channel so that you can be getting all my presentations immediately they are published. Azithromycin is a good medication helping us to handle so many conditions, covering so many bacteria, but we need to use it wisely. I appreciate it. Thank you.